Any couple struggling to get pregnant knows how unbearable it can be. So here to help us shed some light on this issue is the author of If at First You Don't Conceive and the director of the Colorado Center for Reproductive Medicine, Dr. William Schoolcraft. Thanks for coming on the show.
Thanks for having me. Thank
you. And just to highlight how many people this affects, what percentage of couples have infertility problems?
It's 1 out of 6 couples in the U.S., over 7 million people in the U.S. So you're not alone out there if you have infertility.
So let's say you have a couple. They're having difficulty getting pregnant. Right. What kind of test do you recommend initially?
Well, we want a diagnosis. So we look at basically the quality of the sperm, the quality of the eggs, if they're releasing an egg, if they're ovulating, and then the health of the uterus and the fallopian tubes. Those are the basic components.
You should have looked at all the components in a systematic fashion that are involved in fertility. Uterus, tubes, ovaries, with ovulation, and that there's the male factor, right?
Absolutely. Men account for 40% of all infertility, so it's not just a woman's problem.
Right. And if you can, after those initial tests, you start treatment. And Dr. Schoolcraft, he's had a lot of success stories, like Kelly and Sean, who've had one amazing journey. Take a look.
Sean and I met when we were 18 years old.
I knew right away that I wanted to ask her out, and so we started dating and got married.
We just started trying to have kids. It was a couple years of trying on our own, and then decided we should probably consider some other options. And we did 9 rounds of artificial insemination, where I would wait for a phone call from the doctors. Hello? And it was always just bad news.
We weren't sure whether or not to give up on it.
We'd been trying for almost 5 years to have kids. When we went to see Dr. Schoolcraft, we knew going to do the IVF that it was our last resort, but we were hopeful, we were ready for something new. 3 months later, we got the phone call. The nurse on the other line said, "Congratulations." We just wept. We have 3 kids, Delaney, Caden, and Peyton, and they were all IVF babies.
We do have these, conversations with our kids about what a gift they are to us.
Night night, sweet pea.
Night night, Delaney, I love you.
We want our story to be an encouragement to other couples.
If this is your dream, don't give up.
There you go. Good catch. Dr. Schoolcraft, we actually have another couple with us today. They've been struggling with fertility. We have Julie and Jeff here. And Julie, tell us what's been going on.
Well, I'm 46, and my husband is 50, and we really want to have a second baby. So I'm just wondering if you have any tidbits or tricks or something we can use that won't cost us an arm and a leg to help us out to conceive a second baby.
Well, as you probably know, age is a big factor, and being 46 may be your biggest obstacle. But acupuncture and other stress reduction techniques can help women ovulate better. Some supplements have been studied. DHEA, which is a weak male hormone, which you can buy over the counter, may help egg quality. So there's some low-cost options you can try.
And, more and more women are waiting, and putting off childbirth. So this is becoming a bigger and bigger issue in the realm of fertility, is trying to get women pregnant when they're, like in their 40s. More and more women are trying in their 40s because we don't want to penalize them for putting, careers and things like that first. So it's important to have all these other options. I, as a gynecologist, and these are great, acupuncture has the most research behind it to decrease stress and start, ovulation back up. But I, as a gynecologist, I always refer my patients who are over 40 for fertility because time is a factor.
Time is critical.
Yeah.
So say a couple's tried all of these things we've already talked about. Anything else?
Well, there's then high-tech treatments, in vitro fertilization, and one exciting new development we have online now is to test the chromosomes of the embryos before we transfer them. So we can take a placenta cell without touching the baby or the inner cell mass. We can learn about the chromosomes of the embryo, all 46 of them, before we transfer the embryo. So it's like having an amniocentesis before conception, and that has really mitigated the effect of age. We have found that women over 40, if we transfer chromosomally normal embryos, their pregnancy rates are equal to younger women.
And which is great for pregnancy rates because usually then as an OB, patient comes back to me, and the worst thing is to have the miscarriage after all of the tries and things like that. It's just devastating.
Well, and the hardest part is stress can help you not have a baby, and stressful when you're trying to have a baby and you can't. So
It's a circular argument. Yep.
the book is If at First You Don't Conceive by Dr. Schoolcraft. Thank you so much.
Thanks for having me.
Jeff and Julie, best of luck to you all.